topic is opium. Today was supposed to be the second part. So let's have a brief recap. So what do you have? What is your idea about opium? Anyone? Sengupta? Vidita? No. Pritam? So opium is a analgesic. Okay. So this is the এই সাউন্ডটা একটু আস্তে করুন, সাউন্ডটা ঠিক আছে। So this is the pain pathway. Pain pathway starts from the receptors, crossovers, goes up into the brain, and from brain there are certain descending fibers. These descending fibers stops the pain pathway. When there is excessive pain, these descending fibers send signals to stop the transmission of pain. So natural opioids, morphine, codeine, thebine, papaverine, nascapine. Among them, the first to be discovered was morphine. It is the prototype drug. The receptor, something about the receptor. So principally three receptors, mu, kappa and delta. Among them, the mu is the most potent one for analgesia. Kappa and delta also produce analgesia, but the most potent one is the mu receptors. So analgesic is the most important pharmacological use. What other misuse are there for opium? So what Pritam has told? Habituation. Alright. So which type of pain are most effectively controlled by these opioids? So they are poorly localized, dull, visceral pain. What other pain are you familiar with? আর কি পেন হয়? হ্যাঁ, বিদীপ্ত কিছু বলছে, জোরে বল। Anyone? So there is inflammatory pain. হয়? Inflammation পড়ানো হয়নি? So there is pain of inflammation by various type of inflammatory mediators. So which analgesic is more suitable for that pain? So non-steroidal anti-inflammatory drugs are more suitable for pain that is caused by inflammation. What other pain are there? There is neuropathic pain. When a nerve is compressed or there are some injury to the nerve, there is neuropathic pain. What type of medications are more suitable for that? Anyone? No. কিছু পড়াশোনা হচ্ছে না। So the antidepressant, amitriptyline, pregabalin, they are more suitable for addressing the neuropathic pains. So there is this spinal action and there is this supra-spinal action. You mean by the spinal action? So in the pain pathway, so it can be stopped out here or it can be stopped from the brain, alright, the descending pathway that is there. So there is this ascending pathway, it can act either here or via the descending pathway, or it can also act at the site of action. Alright, all of them contains opioid receptors. Opioid receptors are, so other actions, sedation, alright, produces drowsiness. Then respiratory depression. So, the death that occurred due to opioid poisoning is due to respiratory depression. So, you are breathing without any effort, and that breathing is being maintained by respiratory centers. So, these opioids have a property of depression of these respiratory centers that will lead to loss of this breathing activity that is there, alright, and that causes death in case of opioid poisoning. Cough centers. So, cough is a reflex. When any food particle or any foreign particles tries to enter the respiratory pathway, the trachea, or there is excess of some endogenous substance like cough in the respiratory pathway, that leads to the coughing reflex, which is done to spit out the foreign bodies. So, it is a protective reflex. So, these opioids, they suppress this cough reflex. So, how this property can be used pharmacologically? Cough syrup, ঠিক আছে? So, if you have an irritating cough, you can use this opioid to suppress the cough reflex. And when do you need to suppress the cough reflex? During intubation, endotracheal intubation, alright. You have to put a tube in the trachea during surgery or during ventilator assisted breathing. So, in that case you have to suppress the cough reflex. So, you can find that cough syrups are often being smuggled for the purpose of addiction. Okay. So, mood. So, the reason it is used for this purpose of addiction is it's a mood elevator. It produces euphoria. Euphoria means anyone? Feeling of happiness. ঠিক আছে? So, this opioids causes feeling of happiness. Now, this euphoria is caused primarily by the mu receptors, alright. There is this kappa receptor which produces dysphoria. What do you mean by dysphoria? Opposites of euphoria. Depression, hallucination, alright. So, opposites of euphoria, but mu receptors is the strongest of them. So, these opioids are used for addiction. These kicks, that is euphoria, that is what the opioids are used for. Now, let us suppose these mu receptors are blocked. What will happen? কি হবে? Will there be any euphoria? Dysphoria হয়ে যাবে, ঠিক আছে? So, this is the pathway. Now, parts of brain that are stimulated by opioids. CTZ. So, what is the importance of CTZ? Chemoreceptor trigger zone, vomiting center. তাহলে adverse effect কি হবে? Vomiting. ঠিক আছে? Edwinger Westphal nucleus. What is its importance? Oculomotor nerve center. ঠিক আছে? So, what will happen if oculomotor nerve center is stimulated? People will be constricted, pinpoint people. So, that is the sign of opioid poisoning, pinpoint people. Which other condition produces pupillary constriction? Which other drug? Organophosphorus poisoning. ঠিক আছে? পার্থ না? পার্থ has correctly told, produces organophosphorus poisoning produces this constricted people. Then vagal center. So what will be effect of vagus nerve on the GI tract? GI tract কি করে? Secretion কমায় আর it reduces the motility of the GI tract. তাহলে কি হবে? Secretion কমাচ্ছে, motility কমাচ্ছে, constipation. So constipation is another adverse effect. তারপরে cortical and hippocampal areas. Another effect of this opioid is release of histamine from mast cell. Now what does histamine produce? Normal physiological action কি করে? which smooth muscle? কোনটা? জোরে বল। She want to say something but I can't hear you. bronchospasm, ঠিক আছে? তাহলে কি হবে? কি হবে? Bronchospasm, as Arshi has told. So that will lead to respiratory distress. Which other condition causes bronchospasm? Asthma. Alright. So you must be careful while giving it to the patient of asthma. ঠিক আছে? আর what does histamine produces in blood vessels? Vasodilatation. So what will happen to BP? BP fall করবে। ঠিক আছে? So mind it, this is not a immune mediated reaction like that of anaphylaxis. In anaphylaxis, that is an immune mediated reaction. This is not an immune mediated reaction. The opioid simply releases histamine from the mast cell. So BP leads to decrease in BP. GIT, constipation. Among pharmacokinetics, the important part is it crosses placenta. So what is this significance? Well, you will see. Fetus will be affected. So you must be very careful while using it in pregnant women. ঠিক আছে? During labor pain, you must be very careful. ঠিক আছে? Now question comes. Now what is tolerance? Anyone? Tolerance comes as a short note. প্রীতম কি বলছে? ভালোভাবে বলতে হবে। Anyone? পার্থ? Tolerance comes as a short note. So you need to use more drug to produce same action. Alright, same pharmacological action requires more dose of drug, that is tolerance. Tolerance comes as a short note, get it prepared. ঠিক আছে? So all the action produces tolerance excepting two things. GI, in GI it produces constipation, ঠিক আছে, and meiosis. আচ্ছা, withdrawal. So when the person is accustomed to taking drug, his physiology gets altered as per the use of drug. ঠিক আছে? When there is withdrawal, there will be severe reaction in his body. He or she can't survive without the drug. তাহলে কি হবে? So these opioids were producing less secretion. When they are withdrawal, there will be lacrimation and sweating. ঠিক আছে? So there was previously constipation. Now there is diarrhea leading to dehydration. Then yawning, anxiety, fear, restlessness, insomnia. There was sedation, there was this euphoria. So all these actions are gone. Then weight loss, then palpitation, rise in BP. There was this fall in BP, alright, everything gets simply reversed. So, ADR, sedation, mental clouting, lethargy, vomiting because of CTZ, ঠিক আছে, constipation, then respiratory depression, that is the most fatal part of it, ঠিক আছে. Now, why should you use this opioids carefully during labor pain? So, labor pain is a labor is a painful phenomena. So, why should you use it carefully? First and foremost, it crosses placenta. In placenta, the first thing that the baby does when it is born is crying. All right. Due to crying, its lungs expands and it starts to breathe. Now the baby will be sedated. Its respiratory centers will be depressed. All right. So you must be careful in using opioids during labor pain. ঠিক আছে? In addition, it also slows down uterine contraction. What is the significance? The labor will progress very slowly. So you must be very careful during pregnancy. Morphine is contraindicated in head injury. So what happens in head injury? Your cranial volume is fixed. Intracranial pressure বেড়ে যাবে. There is depression of respiratory center. There will be retention of carbon dioxide. All right. That will lead to increasing intracranial pressure. So also there will be vomiting, meiosis, altered mental status. So during head injury, there are certain signs which show prognosis of the disease, how well the disease is prognosing. So all these vomiting, meiosis, altered mental status, they hamper the signs of prognosis. All right. It can produce respiratory depression and increase intracranial pressure, and also your evaluation of a patient, its prognosis, that will be hampered. A Glasgow Coma scale পড়া হয়েছে? পড়েছে? No. অনন্য পড়েছিস? পড়া হয়নি? বাহ। আচ্ছা। So precaution and contraindication, infant and elderly, head injury, bronchial asthma, okay, unstable personality, interaction, use. So often in oral, examiner asks the use. And another thing is indication. Indication means used. বুঝলি? So some of you were asking, what do you mean by indication in the examination? Don't say like that. Indication means used, the condition in which the drug is being used. ঠিক আছে? So dull, poorly localized visceral pain, like any example? Like myocardial infarction. So what is myocardial infarction? কেউ কিছু বলতে চাইছে? হ্যাঁ, পার্থ কিছু বলতে চাইছে? হ্যাঁ, what she has, তোর নাম কি? হ্যাঁ, Kaif. So what Kaif has told is somewhat correct. The blood vessels supplying the muscles of the heart, they are being blocked. That lead to myocardial infarction. So that causes pain. So, these opioids are used in myocardial infarction. So, what is the advantage? So, why is pain harmful in myocardial infarction other than causing this unpleasant sensation? So, when there is myocardial infarction, there is pain that will lead to fear of death in the patient, that I am going to die. That will lead to activation of sympathetic pathway. That will again lead to increase in heartbeat. Alright, the oxygen demand is not met because the blood vessels are blocked. On top of that, we are having increase in heartbeat. So, you need to calm down the patient. For that, other than soothing the pain, it also calms down the patient, it causes sedation. So, opioids causes sedation. So, the sympathetic pathway is reduced. Okay. So, that helps in myocardial infarction. Acha. Pain of metastatic tumor. So, the terminal tumor which has metastasized to large part of the body, there is no cure. In that case, you have to give this opioids as a palliative therapy. You are not curing it, but you are only addressing the pain in the body. Then fracture of bones, then surgical anesthesia. Hey, anesthesia পড়া হয়ে গেছে তো? হ্যাঁ? So what are the opioids used in anesthesia? এই কোকেন ইউজ করা হয় অ্যানেস্থেসিয়াতে? এই পড়াশোনা হচ্ছে না কিন্তু, ঠিক আছে? Cough, it's a cough suppression. Diarrhea, it causes constipation, ঠিক আছে? That property is being used by to treat diarrhea, ঠিক আছে? So, pre-anesthetic medication and post-surgical pain, chiefly for analgesia. আচ্ছা, এই কোয়েশ্চেনটা এসেছিল, why morphine is used in left ventricular failure? কেউ কিছু লেগেনি, সবাই ছেড়েই দিয়েছে. So, it reduces preload. How? It releases histamine that leads to vasodilatation. The veins are dilated. The veins are the capacitance vessel. Alright, when the veins get dilated, blood starts to pool out in the vein. So, it reduces preload. So, what happens? The blood shifts from pulmonary to the systemic side. So, the congestion that is there due to the ventricular failure, that is the left ventricular failure, that is cleared out. ঠিক আছে? Also there is depression of respiratory center. ঠিক আছে? তা কেউ কিছু লেখেনি কিন্তু, কেন জানি না, ক্লাসেও আসছে না, পড়াশোনাও হচ্ছে না. আচ্ছা, মিথাডোন. So, methadone is used in de-addiction. ঠিক আছে? So, methadone is a long acting opioid. It acts for very long time. তাহলে কি করে? It occupies the receptors. So, what happens when the receptors are occupied? So, when a addict takes a fresh dose of, say, morphine, the morphine fail to produce euphoria because the receptors are occupied by the methadone. So, methadone is used in de-addiction program as a substitution therapy. Also, methadone is an opioid agonist. So, all the adverse effect that you So, all the withdrawal signs that would be there, that is not produced. It acts as the agonist, but occupies the receptor, does not produces the euphoria that is there in the opioids. Something more about the receptor. The mu receptor, there are some endogenous ligands like endorphin. So, it produces analgesia. So, the strongest analgesics are the produced by the mu receptor, both in spinal and supra-spinal level. Alright. The respiratory depression that causes death is produced by mu receptors. Alright. Then sedation, euphoria, dependence, these are all caused by mu receptors. Meiosis, reduced GI motility, these are all caused by mu receptors. ঠিক আছে? ঘুমিয়ে বললি নাকি? ঘুমিয়ে পড়িস নি। ও ঘুম থেকে জেগে উঠেছে। তোর নাম কি? হ্যাঁ? মৃণাল? ইমদাদ। হ্যাঁ, ও ঘুম থেকে জেগে উঠেছে। Then we come to Kappa receptor. Kappa receptor also produces analgesia. So, it has an dynorphin is a ligand produced within the body. Alright. So, that is an agonist to the Kappa receptor. What do you mean by an agonist and an antagonist? বল ঘুমাচ্ছে বসে বসে বল হ্যাঁ আর what is antagonist? না. So, agonist is a substance that bind to the receptor and produces intrinsic activity. Antagonist is a substance that bind to the receptor but has no intrinsic activity. It does not produce the opposite activity. Alright. So, Kappa receptor also produces analgesia, both spinal and supraspinal. But instead of euphoria, it produces dysphoria. ঠিক আছে? So, what will be the advantage if I use a Kappa agonist? Respiratory depression হবে না আর no abuse potential. ঠিক আছে? The abuse potential will be low because there is no euphoria, there is dysphoria. ঠিক আছে? Also, it produces psychomimetic action. So, which patient you must be careful? Psycho patient. ঠিক আছে? Patient having hallucination. ঠিক আছে? Mental disturbance. You must be careful about that. So, it also produces dependence, but that is low potential, produces meiosis, respiratory depression will be low, sedation will also be low. ঠিক আছে? So, delta receptor endogenous ligand is enkephalin. ঠিক আছে? The thing that is important is it's a pro-convulsant. So, what is the significant? In which patient you must be careful? Seizure potential. Patient having seizure disorder, you must be careful. So, mu has supraspinal and spinal effect. So, it produces analgesia, respiratory depression, sedation, euphoria, meiosis, bradycardia, hypothermia and physical dependence. Alright, Kappa has spinal analgesia, dysphoria, sedation, psychomimetic action. Alright. There are certain substances which are agonist and antagonist. What does it mean? It means that it is agonist in certain receptor while antagonist in other receptor. So what advantages can we expect from this receptor, from these ligands? So if a receptor is antagonist at mu and agonist at kappa, it will produce analgesia, maybe to a lesser extent, but it will produce analgesia, but its abuse potential is negative, not there. On the contrary, it will produce dysphoria. ইমদাদ, বোঝা গেছে? বাহ, ঘুম থেকে উঠলো। So lack full agonistic activity at mu receptor, so there will be less respiratory depression, less constipation, less dependence, and also less analgesia, because mu is the most powerful of them all. ঠিক আছে? Moderate agonist at kappa hence produces dysphoria. So the abuse potential is much less, but it increases heart rate and BP. So in which patient you have to be careful? Hypertension. ঠিক আছে? It may also produces withdrawal symptoms because it's a agonist at some receptors. বুঝলি? So example, nalorphine. So it's a mu antagonist but a kappa agonist. ঠিক আছে? It produces analgesia, but it also produces dysphoria, psychomimetic effect. তাহলে কোথায় কেয়ারফুল হব? সাইকোটিক পেশেন্টে। ঠিক আছে? পেন্টাজোসিন, so weak mu antagonist. ঠিক আছে? agonist at kappa, low seeing spinal analgesia, lesser sedation, respiratory depression, lesser vomiting, biliary spasm, constipation. So another thing, these morphines are has to be used carefully in abdominal pain, undiagnosed abdominal pain. Why? একটু জোরে বল। ঠিক আছে, what he is telling is right. There may be spasm, biliary spasm. Alright, there may be stone in GB, gallbladder, there may be biliary spasm. So that may be further increased by this opioid drugs. So you must be careful in using these opioid drugs in undiagnosed abdominal pain. Tolerance and dependence on repeated use, oral IM and subcutaneous routes are being used. ঠিক আছে? High phosphorus metabolism, so which route is not very suitable? ইমদাদ, ঘুম থেকে উঠে গল্প করছে। So oral route will not be suitable because of high phosphorus metabolism. So it also produces tachycardia and rise in BP. So where it will be used carefully? Hypertension. So produces dysphoria, contraindicated in myocardial infarction. The opioids I mean the mu opioids were used in myocardial infarction. Now this pentazocine is contraindicated in myocardial infarction. Why? কেন? Well, causes rise in oxygen demand by increasing heart rate. ঠিক আছে? Also in epilepsy, কেন? It may itself lead to a convulsion. ঠিক আছে? Psychosis and head injury. It is also contraindicated in head injury. আচ্ছা, butorphanol, it's a kappa agonist. Alright, strong kappa agonist. So the analgesic effect will be more. ঠিক আছে? It will also produce dysphoria and psychomimetic action. Sedation is prominent, BP not raised. So the adverse effect of pentazocine is much less out here. Alright. So IM, IV, nasal spray all are present. ঠিক আছে? Nalbuphine is a naloxone analog. What is naloxone? এখনো আসেনি, ঠিক আছে? হ্যাঁ হ্যাঁ, opioid antagonist, হ্যাঁ অ্যান্টিডোট হিসেবে কাজ করে। প্রীতম যেটা বলেছে দ্যাট ইজ রাইট, ঠিক আছে? ইটস অ্যান antagonist to the opioid receptor. It's a pure antagonist, not agonist antagonist. ঠিক আছে? Agonist at kappa, weak antagonist at mu. So this also have analgesic effect, produces hallucination. All right. Buprenorphine, so it's a Thevenin congener. Thevenin is a naturally occurring opioid. ঠিক আছে? Partial agonist at Q receptor, antagonist at kappa receptor. তাহলে কি হবে? There will be analgesia. ঠিক আছে? But the extent of analgesia will be low. Slower onset, longer duration of action. So in which case it may be used, কোন কন্ডিশনে ইউজ করা যেতে পারে? withdrawal. ঠিক আছে? therapy for withdrawal, it can be used. So lower tolerance, lower dependence, lower addiction. So now we come to pure receptor antagonist. এটা কি? block all three receptor, but mu is blocked at lower concentration. ঠিক আছে? So why is death occurring in opioid poisoning? পার্থরও ঘুম পেয়ে গেছে। Why is death occurring in opioid poisoning? Respiratory depression. ঠিক আছে? And that is produced by mu receptor. So naloxone, competitive antagonist at all opioid receptor. So like she has said, তোর নাম কি জানো? সিংহরায় না? হ্যাঁ, প্রেরণা। ঠিক আছে? Like Prerna has said that they have no intrinsic activity, only affinity, that is an antagonist. ঠিক আছে? Antagonizes all effect of morphine, fast acting, short acting. So where is this fast acting and short acting becomes useful? Where does this fast acting and short acting become useful? Emergency, ঠিক আছে? acute condition. So acute morphine poisoning এর জন্য this is the drug of choice. ঠিক আছে? Morphine overdose, high phosphorus metabolism, so IV is the most suitable route. বুঝলি? রোমা না? হ্যাঁ। So acute morphine poisoning, so management of acute morphine poisoning, so firstly there will be respiratory depression and the signs and symptoms there will be pinpointed people. ঠিক আছে, তাহলে কি করা হবে? ফার্স্ট মেইনটেইন এয়ারওয়ে অ্যান্ড সার্কুলেশন। এয়ারওয়ে কি করে মেইনটেইন করা হয়? হ্যাঁ বল, ইনটিউবেশন। ঠিক আছে, আর সার্কুলেশন আইভি ফ্লুইড। ঠিক আছে, গ্যাস্ট্রিক লাভার উইথ potassium permanganate. So what is potassium permanganate? हाँ क्या बोलছে? हाँ, it's a very strong oxidizing agent. So it destroys opioids. আচ্ছা, এক্সামিনার মাঝে মাঝে জিজ্ঞাসা করে যে the patient or the addict has taken drug via IV route. Will still this gastric lavage be given? The answer is yes, because the opioids are secreted in the GI tract and it undergoes enterohepatic circulation. ঠিক আছে, so what is enterohepatic circulation? Roma bolbe. No, anyone? Vidita, what is enterohepatic circulation? हाँ, ঠিক আছে, it is secreted in the intestine and again reabsorbed from the intestine. So gastric lavage can still be given. ঠিক আছে, so what do you use? So naloxone 0.4 to 0.5 milligram every 5 minutes till patient becomes normal. What do you mean by normal? Respiration becomes normal. ঠিক আছে, 30 to 60 minutes thereafter to prevent relapse. So naloxone is a short acting fast acting drug. কি বলছি, naltrexone is a short acting fast acting drug. So now we come to naloxone. Naloxone is the naloxone is just like naltrexone but it's a long acting drug. ঠিক আছে, long acting, হ্যাঁ না না, naltrexone is short acting. ঠিক আছে, sorry naloxone is short acting, fast acting, short acting, and naltrexone is long acting. ঠিক আছে, so be clear, naloxone is short acting, fast acting, and naltrexone is long acting. ঠিক আছে, so what is naltrexone used for? Withdrawal, prevent relapse. ঠিক আছে, so it can be used for preventing relapse. তাহলে ওরালি অ্যাক্টিভ, তাহলে আইভি দিতে হবে না বারবার। ঠিক আছে, so it is orally active, opioid blockade in post addict. তাহলে মেইনটেইন, ওই পার্থ যেটা বলছে মেইনটেনেন্স থেরাপির জন্য ইউজ করা যেতে পারে। অলরাইট, reduces alcohol craving, causes nausea, headache and hepatotoxicity. ঠিক আছে, so this is used for maintenance therapy. Once the patient has been normalized, you want to de-addict the patient, for that you use naltrexone, and naloxone is a short acting version, fast acting version used for acute opioid poisoning. ঠিক আছে, any questions? হ্যাঁ, ফেন্টানিল তখন বললি না কেন? এখন সার্চ করে দেখে নিলি নাকি? বইয়ে দেখলি? ঠিক আছে, মিথাইল naltrexone, albumin. So albumin is used for diarrhea. ঠিক আছে, mu antagonist is used for treatment of diarrhea. And these are all naltrexone antagonists, naltrexone congener for even longer duration of action. বুঝলি আশি কিছু বলবে না আচ্ছা ঠিক আছে থ্যাংক ইউ